Right. So looking at the next, all right, diagnostic procedure. Okay. So this is what is known as what colposcopy. Right. So colposcopy is like a diagnostic method, right? So it's usually done by what, using a colposcope. All right. So you can see this. So you put this. It's kind of like a microscope. You put it right into there. Okay, no, not right into there. You use what, a speculum. Use a speculum to like widen the vagina right into the cervix, right? Then use a colposcope to view it. Okay. So it's a diagnostic procedure. It's used to closely examine the cervix. You want to look at the vagina, all right? You want to look at the vulva, all right? And you are looking at this because you want to dictate disease, especially after an abnormal pap smear or positive human papilloma virus test. So it's key for dictating what, if you are dealing with a condition that is before cancer or a condition that is after cancer, like is a cancer itself. So a colposcope is a special magnifying instrument, all right, with light. You use it to view the cervix. The procedure is similar to a pap smear, all right. So the woman will actually lie here, all right. She'll lie on the examination table. You can see the way she took her legs up. That's a stirrup. A speculum is inserted to hold the vaginal walls open. The provider applies a solution like what, acetic acid or iodine, to highlight abnormal abnormal areas. So if suspicious areas are seen, a biopsy, that's a small tissue sample, may be taken for lab analysis. So the procedure usually takes 10 to 20 minutes. Usually done in the doctor's office. All right. So why is it done? A colposcopy may be recommended if you have an abnormal pap test. Right. Maybe you tested positive for high risks of human papilloma virus, or maybe there are visible abnormalities during a pelvic examination, or maybe you have some unexplained vaginal bleedings or genital warts. So it helps to diagnose a lot of problems that could occur in the genitals, like the cervical intraepithelial neoplasia, genital warts, cervical vaginal vulvar cancer, cervicitis, that's inflammation of the cervix, also polyps. All right. So risks. All right. So it's generally safe. Sometimes just mild discomfort. So how to prepare? The person has to avoid sexual intercourse for about 24 to 48 hours. No vaginal medications before the procedure. Okay, so that's just it for the whole concept of colposcopy, which we basically use to examine the cervix, vagina, and the vulva for signs of disease.